There we go. Now we're recording. So, you know what? Now I have to perform. So, anyway, what I want to do, first of all, thank you for coming. And first thing I want to do, I want to start out by talking about the word symptom. And the reason I want to talk about that word is because that's a word that gets so many of us into trouble because we usually wait until we have symptoms before we actually do anything about our health. So, can you give me a definition of the word symptom? Give me an idea.
Definition.
Yeah.
Indication that there's something wrong.
Perfect. That's exactly what it is. It's your body trying to tell you that there's something wrong. It's saying, hey, look, I got a problem. And the thing about symptoms, symptoms only appear after the body is already in a state of disease or a state of crisis. And so what's the problem with that? Well, the problem with that is by the time you have the symptoms, you already have the disease. And in some cases, it can be pretty advanced. In fact, in some cases, it could literally cost you your life, right? And so do you think it's a good idea to wait for symptoms before you actually decide to do anything about your health? Yeah, not a good idea, is it?
It's almost too late.
Yeah, it's sort of like, brushing your teeth only after you find you have a cavity. That doesn't really do much at that point in time, does it? Okay, so when we do get symptoms like back pain, headaches, neck pain, stomach problems, bowel problems, whatever, okay, because those are all symptoms, right? What do we usually want when we have symptoms?
Relief.
Relief. Yeah, perfect. And so what does that look like for the most part for most people? In other words, what do they usually resort to?
Take a pill.
Yeah, they take drugs. Okay? Now, can you tell me what's wrong with that mindset?
Pill doesn't fix the problem.
There you go. It doesn't get to the cause. All it's doing in most cases is just actually treating the symptom, right? It's not really...
Masking.
Yeah, masking the symptom.
And treating it.
Exactly. And so when it comes to symptoms, do you think lack of symptoms or feeling good means you're healthy?
Well, not necessarily, because you can still feel good and still have something wrong.
Absolutely. I mean, health has nothing to do with how you feel, if you really think about it. I mean, if you look, for instance, say, high blood pressure. Do you feel high blood pressure?
No.
No. Do you feel high cholesterol? No. Do you feel low calcium levels in your body? No. Do you feel a tumor when it's just starting to grow as a single cell? Do you feel that?
No.
Absolutely not. So health really has nothing to do with how you feel. And so what do you think is the best option when it comes to your health? Do you think it's a good idea just to cover up the symptoms or hide the problem? How many people think that's a good idea? Nobody here. Do you think it's a better idea to actually get to the underlying cause and treat the problem? Yeah, that's a better option, isn't it? So we need to talk about sick care versus health care, right? So if you wake up in the morning and you feel great, you're fully alive, you're full of energy, no symptoms, do you think to yourself, gee, I should call my medical doctor? Do you think that? No, you don't, right? When do you call your medical doctor?
When you feel bad.
Yeah, when you're sick. Now, although sick care and crisis care are very important parts of our culture, do you know what? They really have nothing to do with health care or health. Does that make sense to you? Right? And so we need to talk about health. So how many people here think that good health is important? Yeah. Now, why would you say that?
Because without good health, your life is no good, no
Yeah,
fun.
yeah, there you go. Because what do you need your health for? For instance, do you need good health to be able to go out and work to earn a living and support your family? Yeah. Do you need good health to be able to do things with your family, like take them to the skating rink or take them out hiking or whatever you like to do? Do you need good health to do that? Mm-hmm. Absolutely. Do you need good health to do things for yourself, like for instance, say you want to play sports, play tennis, ski, whatever. Do you need good health to do that? Absolutely. So is there anything you don't need good health for? Nothing, right? You need good health for everything, right? Now, what would your definition of good health be? What would you say good health is? Not a trick question. Any ideas? Eric, any ideas?
Well, I know what it is, but I don't know if I can put it into words. That's
Well,
the
give it a go, and then we can discuss it. Any thoughts?
Good health would be, well, there's mental health, physical health,
Right.
spiritual health.
Yeah. Those are all aspects of good health, right? That you have to look after, right?
And good health would never have to see your doctor. That would be good health.
Well, that's one definition. But remember we just said lack of symptoms doesn't necessarily mean you're healthy, right? So, usually you don't go to the doctor when you don't have symptoms, okay? But you still might be sick. You just don't know that there's something going on inside. And there's a reason for that. It has to do with the neurology in your body. Because you've got nerve cells called nociceptors, which send information to your brain about tissue damage going on in your body. But most of that information is on a subconscious level. You're not even aware of it. And the only time you actually become aware of it is when it goes into the conscious level. It goes into what we call the limbic system of the brain. Your brain gets hit by approximately at least 3 trillion bits of information every second. Only 50 bits of that is conscious. Only 5 bits of that is devoted to pain, right? So you have to have a significant amount of tissue damage before it reaches a threshold where you actually perceive the pain. That's just the way your body works. Otherwise, everything you did would cause pain. Does that make sense? Okay. And so really what health is all about, it's all about good health. It's all about what I call the chiropractic F word. And it's not that short little 4-letter swear word that you hear all the time. It's function. It's when every organ, every tissue, every cell, your mind, everything is functioning at its optimal level. That's what good health is all about, right? And of course, I always tell people the other end of that spectrum to good health is death. That's the bottom line. And, most of us are somewhere in between, right? But the longer time you spend in balanced and homeostatic and optimal cell function and optimal, body function, do you know what? The happier you are, the fitter you are, the stronger you are, the kinder you are, the more energy you have, the better you look. I mean, it just goes on and on and on, right? Because there's nothing that determines the quality of your life more than your health, is there? Is there anything in it? There isn't when you start thinking about it. Because you need good health, like I said, for virtually everything, don't you? And so that's what today is all about. Today is all about giving you guys a vision of actually where we're going with your health. Make sense? Okay, so I got a question. Do you, any of you know what the leading cause of death in Canada and North America is?
Smoking.
Well, that doesn't kill you. Smoking doesn't kill you. I mean, it kills you by causing. You said one of the things. You said cancer. What else? What else can smoking cause?
High blood pressure.
Yeah, exactly. Cardiovascular disease.
Cardiovascular.
Right. And so the number one cause of death in Canada and the United States and North America is cardiovascular disease. Right? I did a study on that. I researched that. In Alberta, the last year that we had statistics for, 57% of the population died from cardiovascular disease. Now, that cardiovascular disease is all types of cardiovascular disease. So it's not just heart disease. For instance, stroke is a cardiovascular disease. Okay, so 57%, which means over 1 out of 2 people are dying because of cardiovascular disease. Cancer is the next one. You mentioned cancer. They estimate it kills 1 out of 3 Canadians. So if you do the math, that's like 5 out of 6 Canadians that are dying needlessly before their time. Now, why do I say that? Because you know what? The Bible actually says we should be living, 80 to 120 years. Scientists have come out and confirmed that. Geneticists say that we should actually be living until we're 120 years old. Now, I got a question for you. Who wants to live to be 120 in this room?
Well, it depends, I guess.
Yeah, that's a good
answer. I don't want to live to be 120 in a wheelchair, that's for sure.
Yeah, you don't want to be like that.
But if I was healthy and...
Yeah, and that's a great answer. But you know what? When I ask that question, most of the time, nobody puts up their hand. Nobody says they want to live to be 120. And it's exactly because of what you just said. It's because of the perception of the quality of life that we're going to have when we're 120. Because most of us have this vision of being stuck in some hospital bed or in a nursing home. You know, we're attached to machines, we've got tubes coming in and out of our bodies, you know, we're on drugs. In fact, we're so drugged up, we don't even recognize our family, right? I mean, who wants that? I mean, there's not a person on this planet that would want that for their life. And so that's why most people don't want to live to be 120. But yet, we still have the genetic potential to actually easily live to be 100 years old. And so, and have a good quality of life. Now, I got a question for you. Why isn't that happening? What do you think? Any ideas?
Millions of things. Well, not millions, but diet,
Yeah,
pollution,
yeah. All sorts of different
stress,
things.
all sorts of
Yeah.
things.
Do you know what?
Crossing against the light.
Yeah. Do you know what? I mean, yeah, there you go. Basically, the reason why that's not happening, stress and the quality of life that we have, the quality of choices. Because you see, we talked about what good health is, and there's actually 5 things that you have to do to be healthy. And I call them the 5 sort of pillars of good health. Do you know what they are? What are they?
Proper nutrition.
Yeah, you got to eat well.
Exercise.
Yeah, you got to move well. Anything else?
Your brain, you got to think well.
Yeah, you got to think well. Stinking thinking will kill you. Okay? What else? There's 2 more. These aren't quite as obvious. You got the main ones though. You're doing good. Any thoughts? Well, you got to get enough rest, right? Because your body actually repairs and regenerates while you're at rest. So if you're not getting enough rest, guess what? Your body's unable to repair itself. Okay? You're going to break down. Okay? And the last one, which a lot of people don't think about, is actually the most important of all of them. You got to have a healthy, functioning nervous system. Now, why would I say that's the most important?
Because your nerves control everything
Yeah,
in your body.
yeah, because this is the master controller of the body. It controls absolutely every function, everything that goes on, you know, with your nervous system. You literally live your life through your nervous system. Does that make sense? And so even if you did everything else, even if you ate well, exercised regularly, got enough rest, you know, had healthy thoughts, which is all good stuff, if you don't have a healthy nervous system, you're not going to get the value out of that. Does that make sense? You won't benefit from it. I'll give you an example. You can eat the best food in the world, but if the signal going to the stomach isn't getting through properly to break down the food, in other words, to secrete enough acid or enzymes or whatever, then you know what? You're not going to break that food down into small enough particles. Where's it going? Where's it going? Right out the other end, because you're not absorbing it, right? And so basically, those 5 things that we talked about, they're what we call lifestyle choices, right? They're lifestyle choices. And it's the lifestyle choices that you make today that are going to determine your health future. Even if you feel 100% right now, it's the choices that you make today and every day that are either going to destroy your health down the road or allow you to express your life to its fullest in every dimension and live up to your full human potential. You know what I believe? I believe that we're designed to be here on this planet. I think nobody's an accident. Every one of us is you know, supposed to be where we're supposed to be. But here's the hard part about life. My belief is that basically we have to find out, discover what we're passionate in life about, and then pursue that. I think when you do that, you're fulfilling God's purpose for your life, right? But the hard part, finding out what you're passionate about, right? But that's my belief, okay? And if we have, you know, optimal function of our nervous system, that's going to allow us to be able to live at a higher level of life. And we actually know this from research studies. We know that your brain functions at a higher level. We know your immune system works at a higher level. All these different things work at a higher level when you've got a healthy nervous system, which is dependent on you actually having a healthy spine. But the reason why we're not living, you know, to be 100, it's stress. It's a lifetime filled with chronic stress due to chronically poor lifestyle choices that's destroying our health and well-being, and it's actually killing us prematurely. And so I have to explain the mechanism of how that happens. But before I do that, I want to explain the 3 different types of stress to you. Do you have any idea what the 3 major stresses are that happen in your life?
Physical,
Yeah.
mental,
Yeah. One more. Doing great.
nutritional.
Yeah, chemical or nutritional, right? Same thing. Okay, so physical, chemical, emotional. Those are the 3 major types of stress that we have in our lives. See, and all of us need a certain amount of stress in our lives to actually function properly. In fact, if you had 0 stress in your life, do you know where you'd be? Any idea? You'd be 6 feet under the ground. That's the only time you have no stress. Do you understand? Okay, so there's a certain amount of stress that we have. It's called eustress. It's actually good stress. We need a certain amount, okay, of stress in our lives to actually function properly. But here's the problem. The problem happens when that stress starts to overwhelm our body's ability to adapt to it. That's when we start to have trouble or problems. And so what happens, I've got to explain the mechanism of action of how that happens to you. Because it's your nervous system that's responsible for filtering and processing all stress. In fact, your nervous system literally remembers every single stress you've ever had in your life. And you might say to me, oh, come on, Dr. Jack, I don't know if I'd buy that one. I mean, you know what? I can't remember what happened to me when I was 5 years old or 6 years old. And you know what? You might not be able to remember some of that. But you know what? Your nervous system still does. And I want to give you an example of how that happens. So let's say probably around 5 or 6 or 7 years old. Anybody here remember learning to ride a bike around about that time?
Mm-hmm.
Yeah. And so if you remember what happened, okay, or if you don't remember and maybe you did it with your kids, you get up on the bike, you fall. You get up, 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 you fall. Well, after a half dozen times or so, you can ride that bike, yeah? Right? Remember that? Okay. So what you did, you put a positive physical stress into your body. Your nervous system, your brain, had to physically and physiologically change in order to adapt to that stress. And so what you did was you actually developed new nerve patterns, you know, stimulated nerve pathways that weren't stimulated before, so that you actually had the balance, strength, and coordination to be able to ride that bike. So that you actually made these, what I call, healthy nerve patterns. Does that make sense? Okay. All right. Now, let's say you stop riding that bike for 1 year, 2 years, 3 years. Then you go to get on that bike. Can you still ride it?
Yep.
Absolutely. Now, the reason you can still ride it is your nervous system permanently changed. That stress affected or impacted your nervous system permanently. Because if it hadn't have, then you know what? You'd have to learn how to ride that bike all over again. Does that make sense to you? So every stress we've ever had actually changes our nervous system, right? And so it's our nervous system that has to adapt to all stress. And so here's what happens. Your internal ability to adapt to that stress determines whether you're going to stay healthy. And it's the nervous system's ability to adapt to that stress. So if you can meet the demands of the physical, chemical, and emotional stress that you're pouring into your life, guess what? You get to stay healthy. You get to stay happy. You get to have fun, right? Because your body can adapt to that, right? If, on the other hand, though, the amount of physical, chemical, and emotional stress that are pouring into your life overwhelm your internal ability to adapt, which is your nervous system's ability to adapt to that stress, then you know what? You actually develop what we call unhealthy neurological patterns. And then your body starts to break down. Does that make sense? Now, here's the question. How would you know you're developing unhealthy neurological patterns? How would you know that? Any idea?
Education.
There you go. I'm teaching you. Okay? But
Because if you go home
yeah.
and lay on the couch every night and watch TV and
Right.
eat chips, you know that you're creating stress on your body.
Well, that's true. And so yeah, you're actually right when you look at it that way. We know that that's not a healthy thing. But how would you actually know whether you're developing unhealthy neurological patterns? See, there's only 3 ways, okay? Number 1, you don't, right? Number 2, you feel something, right? Here's the problem. What do we say about feeling things? By the time you feel it, what have you got?
It's too late.
It's too late. You've already got the disease. There is a third way though, okay? The third way is when we do your nerve scans. Do you remember the nerve scans that we did? And we're going to be going over them with you. There's a couple of those nerve scans that we do that tell us what's going on with your nervous system. And so I want to explain a little bit about how that happens, because see, you've got 3 layers to your spinal system. You've got the muscle layer, you've got, and as we go deeper, muscles are most superficial, you got the bones and the joints, and then you actually got the nerves themselves, the spinal cord and the nerve tissue, right? So when you're under stress, stress always hits this layer first, the muscle system. That's why, how many of you here have, gone through a stressful time and you feel like that, like really tense in the shoulders? You ever felt that? Okay, the muscles are tightening up, you feel like your ears are part of your shoulders, you just kind of one big knot. Well, that's exactly what's happening. That stress is impacting that muscle system, that muscle layer, right? Well, one of the nerve scans we do is called a surface electromyograph. What it does is it's actually picking up electrical activity going on in the muscles. When we do that scan, we want to see white bars and we want to see balance. Does that make sense? Okay, so when we get colors on that scan, it can be green, it can be blue, it can be red. That indicates mild, moderate, or severe or intense nerve interference, right? And so when we see colors, we know that those muscles are contracting much harder than normal to hold you in an upright position, because what's happening when we do those scans on you, all you're doing is standing there, right? It takes very little energy to hold you upright like this, right? Because all you're doing is standing there. So if you've got good, proper posture, proper alignment, what happens, those muscles, they don't have to work that hard. The problem is, when we see those high bars, when you're just standing in that position, we know those muscles are working overtime, right? And that's a tremendously energy-intensive process. So it's taking a lot more energy just to hold you upright than normal, right? And so it's an exhaustive process. And so when we see a lot of red bars on that scan, usually I'll get people in and they'll tell me, like we'll talk about it, and I'll say, look, you're expending a tremendous amount of energy and it's an exhaustive process. So usually and that's just to stand upright, just to be upright. So by the end of the day, there's no energy left for your digestion, for your metabolism, for all these other things, and you're bagged. You go home and guess what you gotta do? You gotta, hit the couch. Does that make sense? Right? And so basically, that's what's going on, right? Now, does it make sense that your muscles should pull evenly on both sides? Right. So when we do those nerve scans, that computer, the neat thing about that system is that computer actually calculates how much the muscles are pulling on one side compared to the other. So if we see a muscle that's pulling 300% more on one side than the other, we know that's a shear force, right? It's creating a shear force at that area. We know that area of the spine is going to start to break down, okay, if that goes on over a period of time. And what's really interesting, it's just like, I'll use the example, I'll compare it to a bow and arrow, okay? If you take a bow and arrow and you pull on the bowstring, what happens to the bow?
Curves.
Yeah, it curves, it bends, right? Well, that's literally what starts to happen to your spine, because those muscles start to pull unevenly in different directions, and then what happens, it literally starts to bend or warp your spine out of alignment. So instead of having this nice forward, what we call C-curve, remember that's a healthy curve, your spine can start to straighten, okay? Now the consequences of that are eventual degenerative changes and damage to the spine, and I'm going to talk about that in a minute. But what's even more important is the consequences of that, or what's going on with your nervous system, and in particular, what's it doing to your brain. And so we'll come back and talk about that in a second. But what we know is, and by the way, the only way we know that that's happening is, and that's that second layer, that's the bones and joints that we're talking about, right? Those are the hardest tissues in your body, your bone system, your skeletal system. So we know that when we see colors on this scan, and then when we take your x-ray, if we see the spine straightening, we know that the stress has gone in here and now it's going deeper. It's affecting, it's impacting this area, right? And we know that when you have that, you have a spinal problem, you have a health problem. Or sorry, a spinal problem, a back problem, right? Where we really get concerned when that stress starts to go into the third layer, okay? Because that third layer is the spinal cord and the nerves themselves. And so the scan that we do to detect that is called a thermography scan. And with that scan, we can tell, if we see colors on that scan, we know that your nerves are actually getting stained from the stress that's going on inside. And since the nerves control your organs and tissues, we know that it's no longer just a spinal or a back problem, but that it's actually a health problem now. And so one of the things that happens that, I see a lot of people, they may have gone to a physiotherapist or maybe a massage therapist, and you know what? They work in these layers. The massage therapist and the physiotherapist, they work in those layers. And they can help a lot of people. They get some great results, okay? But sometimes I'll see the people that go that route, they don't get any better. They end up coming to see us, okay? Well, the difference between what they do and a doctor of chiropractic like myself is we work not only in these layers, but we also work in this layer, okay? We're mostly concerned about this layer, which is the health of your nervous system. Does that make sense to you? Okay? Now, it's the thermography scan that tells us that, okay? Because thermography, and this is all based on research, is one of the most, very simple technology to use, and one of the most accurate diagnostic techniques that you can use for determining function of the sympathetic nervous system. And it's your sympathetic nervous system and parasympathetic systems that control, those organs and tissues inside. So the cool thing about that technology is we can literally measure the impact of physical, chemical, and emotional stress on your body, on your nervous system, long before you actually develop symptoms of chronic, in fact, potentially life-threatening chronic disease. So that's why we do those nerve scans. Does that make sense to you guys? Awesome. So basically, when we go over your scans, we'll be showing you like before and after scans and explaining, what's going on and what's happening. Okay? So I just wanted to explain that to you so you understood. I want to talk or backtrack a little bit now, and I want to talk about that second layer. Okay? About the bones and the spine itself, the vertebrae. And so basically what we want to see, normally on an x-ray, we want to see this type of a curve, okay? A nice forward C curve. What happens when we get this sort of a thing happening? Well, like I said, those muscles are literally pulling the spine out of alignment, okay? And there's two things that happen, okay? And this is based on research, okay? This actually comes from Kapanji, Physiology of Joints. For every inch of anterior head syndrome, that means the head is forward, which means when that's happening, the spine is straightening. Okay? So for every inch of forward anterior head syndrome, rather, it can increase the weight of the head on the spine by an additional 10 pounds. Now that's presuming your head weighs 10 pounds. Okay? Some people's heads weigh 12 pounds. So your weight of your head is about 10 to 12 pounds. Okay? Now, you figure that out. You think about that. When you're in this normal position, your head weighs 12 pounds, and so your muscles have to contract in your neck with about 12 pounds of force in order to keep your head on your neck and on your shoulders so it doesn't go rolling off. Okay? Now, what happens, you got 1 inch of forward head posture, it now takes 24 pounds of force to hold your head there. 2 inches, it takes 36. 3 inches, it takes 48. Okay? You take people, and a lot of what we do in our society is what I call flexor dominant. In other words, we're in positions, we're at desks, our work is in front of us, we're technicians, we work on things in front of us, and we're bent forward. We're bent forward. Our shoulders are forward, our arms roll forward, our head goes forward. And what that does, basically, that continually exercises one group of muscles at the expense of the other. So your flexors are continually exercising, your extensors aren't. We become flexor dominant. And then what happens, that leads to these postural change patterns that we're talking about right now. And then eventually it can lead to pain syndromes. But even worse than that, it can actually start to cause significant structural change going on in the skeletal system, in the spine itself, degenerative changes. And so I want to explain how that happens, because let's say you've got your head forward about say 3 inches, okay? And you do that for 8 hours a day, 5 days a week at your job. Well, that's an extra almost 50 pounds of force on the spine, right? Those muscles are contracting with that much force just to hold your head on your shoulders. And so what happens, instead of having 12 pounds with this nice curve forward like this, when the spine is like that, those joints, they glide nice and smoothly. You got extra force, you got 50 pounds of force. Do you think that's going to cause more friction on the joints? Yeah, it's going to cause more friction on the joints. So over time, what happens, those joints, they start to grind. And a good analogy I use is, it's like a sliding screen door. Do you know, if you ever had one of those in your house, or you know, known people that have them, you know, over time they start getting a little sticky. You know, maybe the bearings start to wear out and it gets harder to move it. And then one day, you know, it's kind of hard, and maybe you give it a kind of a bit of a hard shot. And what it does is it pops off the track, right? You ever experienced that? Ever seen that happen? Yeah. Okay. And so here's the thing about your innate intelligence, not your innate stupidity. Okay? Your innate intelligence, it doesn't want your vertebrae to pop off the track. So you know what, by the way, you know why? Because if that happened, that would sever your spinal cord. And you know what? That's never usually a very good thing, right? So what your innate intelligence does is it tries to stabilize that area. And what it'll do is it'll cause bone spurs to start to form, and the discs themselves will start to degenerate. And basically, eventually, if it gets bad enough, it can actually go into fusion, where those joints literally fuse. Here's the research behind that. This comes from the Mayo Clinic, November 3rd, 2000. Anterior head syndrome, which is what we just talked about, leads to long-term muscle strain disc herniations, damage to the discs, arthritis, and pinched nerves. This process that I talked about, this is also called arthritis. It's called degenerative joint disease, it's called subluxation degeneration, it's called osteoarthritis. All of those words, they mean the same thing. And all it is a condition that was actually identifiable sometimes decades earlier, but typically left because there was no symptoms at the time. But this is going on inside of you in an unperceptible way, because what's happening is that damage hasn't reached the level of conscious pain perception. Okay? Do you understand that? Okay? But it's still happening. Now, as it's happening, it's destroying your nervous system as well. Okay? And that's the problem with it. Because what happens, basically, your nervous system, actually your spine in particular, activates your brain. Okay? Because we talked about mechanically why it's important to have this good posture. And by the way, I like this chart here, or this poster, because this is actually from a guy by the name of Harry Farfan. Look at all the initials behind his name. But he did research on this, and his conclusion was that aging and degenerative arthritic changes are not synonymous. In other words, this process doesn't have to happen, okay? But the reason it does happen is because we're not looking after the health of our spine, okay? Now, the other thing that's really, really important that I wanted to discuss as to why this curve, it's so important to have that C curve on you, is because what happens, according to research studies, and I'll just read this right off to you. This comes from Dr. Roger Sperry. He was a medical doctor. He was given the Nobel Prize for brain research. He was a brain researcher, okay? And what he discovered, 90% of the stimulation and nutrition to the brain is generated by the movement of the spine, okay? And I want to explain how that happens, because you've got in through the joints of the spine and other extremities as well, but primarily the spine we're talking about, you've got nerve endings called proprioceptors, mechanoreceptors, joint receptors. And what happens, basically, when your spine has proper alignment and movement all the way through its normal ranges of motion, and when you're upright and you're active, you're actually stimulating all those little nerve endings, okay? Now, why is that important? Because what those nerve endings do, they send information through the basically spinocerebellar tracts and posterior columns of the spine to the cerebellum. And what that does is it activates the cerebellum. Now, the cerebellum is one of the smaller parts of the brain, and yet it actually has at least 60 billion of the almost 100 billion neurons that you have in your brain. So it's a pretty important little part of the brain. So what happens when we fire off this area of the brain, then it actually modulates signals, okay, and sends that information through the thalamus. And I take that back. It's the thalamus that actually modulates the signals, okay? It's like the gateway to your brain. And then what happens, the thalamus then sends the signals up into the cortex, into the what we call the cerebrum, okay? This is called thalamocortical pathways. And what happens when we have proper activation of these nerves going on, it's actually firing our cerebellum, it's keeping our cerebellums healthy, and it's firing through the thalamocortical pathways to actually keep your cerebrum healthy, right? And so that's why this is so important, because you see, when you have subluxation going on, now there's three components to subluxation, and I talked about unhealthy nerve patterns, okay? The other component to subluxation, usually there's some kind of stretching or compression or traction forces going on in the spinal cord and the meninges themselves. And so I wanted to just show you an example of that aspect of subluxation, because this is actually a dissection study of the cervical spine. You can see a nice normal C curve. This is the x-ray on the one side, this is the dissection on the other side. And you can see how the spinal cord is nice and relaxed in there. If we flip the page and go to the next one, this is called phase one. And basically it's by these charts up here you'll see on the wall. So you'll see how the spine is straightened, and you'll see how the spinal cord looks a little narrower in there. Well, it's like taking a rubber band and you stretch it. What's going to happen in the middle of it? It's going to what?
Get skinnier.
Yeah, it's going to get skinnier. So you can see that happening to the spinal cord. And by the way, 70% of subluxations do not involve compression of nerves, they involve traction. Okay? This is actually the phase two. You'll see here, there's actually some nerve damage going on in the spinal cord. There's a black hole, not a very good thing. And then if you flip again, you're going to see multiple areas of insult into the spinal cord. It kind of looks a little bit like a snake. That's going to affect multiple areas in the body. And then the last one you're going to see is you're going to see a spinal cord, and basically you see it up above and then down below. Where is it in the middle? What's happened to it?
Stretched, shrunk.
Yeah, it shrunk, right? It's almost gone. Well, I got a question. How's the life supposed to keep, your body alive to get to all these organs and tissues? And also, how's that information to activate your brain from those nerve endings we talked about? How's that supposed to happen?
Gotta squeeze it through there.
Yeah, I've got to squeeze it through there. Or, in many cases,
it
you know what?
doesn't go through.
Yeah, there you go. It doesn't. And you know what? We don't see a lot of phase fours in our office, because usually they're in one of two places. Where do you think they are?
Old folks' home or the cemetery.
Exactly. They're either 6 feet under the ground, or they're in an old folks' home, right? And I was going to say, the old folks industry, by the way, is one of the fastest growing industries in North America right now. They're popping up left, right, and center.
Population, that's
Well, and that's what you would think, right?
Most of our population is getting older.
Well, that's what you would think. But let me tell you this. This is the first year that baby boomers are going to retire. The first wave of baby boomers is right now. So guess what? The bulk of the population still isn't senior. So why do you think we got more people going into seniors' homes now, and we haven't even got the baby boomers there yet? Why do you think that is?
Having more issues at a younger age.
Lack of health.
Lack of health.
Well, lack of knowledge.
Yes. You know what? I love that. Because you got lack of knowledge.
Since I've been coming here, you've taught me a lot.
Yeah.
Actually.
Lack of knowledge about your health, right? And thank you for that. I appreciate that. I hope you appreciate what I try to teach you and the things that we talk about and stuff.
I'm going to go open my own shop.
Yeah, there you go. Because this is critical for you guys to have a better quality of life, right? But you know what? I mean, the reason why we've got more people going to seniors' homes, are we more sedentary than we've ever been at any other time in the history of our society? Do you know what sedentary means? Not moving?
More and more technology.
Yeah. So you know what? When I was a kid growing
I
up...
have to get out of my desk to fax now.
There you go.
Send a fax right from my computer.
Yeah,
You have to get up.
There you go. And and a good analogy of that, when I was growing up, you actually had to get up out of the couch, you had to walk over to the TV, and you actually had to turn the dial. You only had 3 channels, right? Well, nowadays, you got these multi-controls that turn everything on, including your bathroom lights, and you just sit there on the couch and you can go like this, or it's like Star Wars, right? Right? And you can get any channel in the world, right? And so guess what? We don't move anymore, right? And so when we're not moving, guess what we're not doing? We're not activating our brain. Okay, so we talked about physical forces. The third component to subluxation, movement, right? And again, why is it important to move? Well, Dr. Sperry said 90% of the activation of your brain and nutrition, I like that word nutrition, comes from movement. See, your spine, or sorry, I shouldn't say your spine, your brain needs three things to work properly. It needs energy, so it needs glucose, and it needs oxygen, and it needs activation from the nerves in your spine. That's what it needs to function properly. And if it doesn't get that, guess what? You're in trouble, right? Because that's what your brain needs. And so what happens is that brain of yours is activated by this pathway that I told you about. When you have subluxation, it stops normal movement. It prevents normal movement in the joint. So what happens? You're not activating those nerves. What do you think's happening to your brain? Do you have any idea?
Shrinking.
Yeah, it's literally shrinking. And we know that from research studies. In fact, they did a research study where they had people, they did functional MRIs of their brain and found out what areas of the brain were working, and they mapped that all out. Then what they did is they put them in cervical collars. Well, cervical collars, they actually simulate subluxation, so they tend to push the head up and forward, and they stop movement, so you can't move anymore, right? And then they did functional MRIs on these people's brains at intervals after they did that. They found within 2 weeks, the function of the brain dramatically changed, and the brain literally started to shrink, right? So they could measure that. We know from studies, Alzheimer's people, we know that basically just by walking decreases the incidence of Alzheimer's by 50% and can delay the onset of Alzheimer's by 10 to 15 years. How does that happen? Walking. What are you doing?
You're moving.
Yeah, you're upright, you're moving, you're stimulating those nerves. One of the best things you can do is walk, right? That's why I try to say, people, get out, walk. And it's not what it does for your heart and lungs. And don't get me wrong, it's good for your heart and lungs too. It's this. It's the most important thing is what it's doing up here. Because you know what this does? Controls the heart and lungs, right? This ain't working, these aren't working properly, right? Does that make sense? And so it's critical for you guys to understand this, because you see, we know with Alzheimer's, the brain is literally starting to shrink 10 years before you develop symptoms of Alzheimer's. So what happens is we've got this slow degenerative process going on in us, and because it's so slow, it's imperceptible, because our spines aren't functioning properly. And when your spine isn't functioning properly, your brain starts to degenerate. It starts to not to work properly. You start to get, functional disorders. All these different types of things start to happen. Okay, and that's why it's critical to maintain the healthier spine. Be subluxation free. Be active. Just walking is a good activity. You don't have to go run a marathon, right? And I talk about with you guys some exercises, rebounding on a mini trampoline. I love my mini trampoline. I started bouncing on it, and one thing I noticed by doing that, my posture has changed quite a bit, actually, because now what we're doing is we're really working some of the extensor muscles in the body, and I noticed a big difference when I started doing it. And it's cheap; it's only about a $40 investment, right? And you can sit it up in front of your TV and watch X Factor while you're doing it, or whatever, right? But it's a great little piece of equipment, and I encourage people to use that and start moving their arms when you're on it. You can even get a bit of a cardio workout and stuff like that. So pretty, excuse me, pretty important stuff. What I want to do, I want to show you some x-rays now, and I just want to put these up so I can show you what's going on. This person here is a WAD, or not a WAD, that's a whiplash associated disorder, and I don't know why I said that, but I'm used to thinking that when I see x-rays like this. But I know this person's history, so I guess he would have been, at the time, a WAD 4, okay? WAD 4. Do you know what that means, Mitch? Because you work in the auto insurance industry, don't you?
Yeah, I don't know.
You don't know
much
what they
about
mean?
that.
Okay. Because that's more the
4 is
personal
probably
injury.
worse than 3, which
Yeah,
is probably
WAD 4
worse
is the
than
worst.
2, which is
WAD
probably
4
worse
is the worst. There's actually fracture. Okay, and I'll tell you why, what about that in a second. Okay, because there's no fracture on this person's spine, but you'll see here, you'll see this damage. Okay, you'll see the bone spurs and the thin discs, and there's actually calcification of some of the muscles in the front of the spine. Okay, see how straight the spine is? Okay, so this is a WAD 3. Sorry, this is a phase 3. I keep wanting to say WAD. But this is a phase 3 by our classification on X-ray, okay? And now, what you'll see now, you'll see the curve starting to come back. You see a better curve? Okay? Now, you still got the damage in here. The discs are still bad. The bone spurs, the calcium is still there. That will never go away. That's permanent change. See? And that's the problem. When a person gets to be, a phase 4, okay? And I've got it on that chart. We don't have it on this one. But do you know what? A lot of times there's not a lot we can do for that type of a person, right? If we can catch them earlier, the better we can do, okay? But you'll see the curve still came back, right? Well, I'm going to explain the history behind this because those X-rays are mine, okay? That's my neck, okay? I was involved in 2 accidents. I tell people I just about died in one of them, but I probably just about died in both of them. I actually fractured the back of my skull in one of them. That's why I said it would have been a WAD 4, right? And then I had neurological damage. I had a concussion. I was like Sidney Crosby, even maybe worse than him. And well, I was worse than him. I ended up in the hospital. I was in the neuro unit in the intensive care for a couple of weeks. And you know what? They helped me. I got out of there, and I was grateful. I mean, I was grateful for the care. And about maybe a year, 2 years later, I started developing headaches, and I never had migraines. But it was like this constant, it's like this band of pressure. It was always there, never went away. I had it when I woke up, I had it when I went to bed. Well, I always had this problem, and of course, who wants to take pills for the rest of their life, right? I don't think there's a person that wants to do that, right? So I started seeing chiropractor, and guess what? My headaches got better. So I thought, hey, this is cool, right? I can do this, right? I'd like to help people doing this. So here I am a chiropractor, 30 years later. So I went to school. Now, the thing is what I was taught back then, when you got a person and when they're in pain, get them out of pain, and then if you want to do any kind of a maintenance care program, get them in once a month. Here's the problem with that. See, because that's what I did for myself, right? And that's what I recommended to my patients for many, many years. But I didn't realize at the time that that wasn't the best advice for that patient. That wasn't the best thing for them. So I did the same thing that I was telling my patients to do, which was, get an adjustment once a month, just to try and maintain some of the health of the spine. The problem is, this degenerative process continued on, because if you look at this first X-ray, see all this damage in there? Well, when I saw my first X-ray, when I went to the chiropractor, it looked like that. That actually continued to happen, even though I was getting once a month adjustments for 20 years. Still went on. Problem is I had forward head posture, I had a straightening of the curve, I had that increased wear and tear, and I developed, that's called osteoarthritis. That's what that's called, okay? Mayo Clinic. I mean, there's other studies out there that show that. But it kept going on, even though I was getting once a month adjustments. The reason, didn't have my head back over my shoulders, didn't have my curves. It was a continual degenerative process, that wear and tear that we talked about, the extra weight on my spine, it kept going, right? Well, we now know if we don't get that curve back, this is going to continue, right? It's just a matter of time, all right? And so we now have techniques for getting the curves back. And then we also know, because of the research, and I told you about some of the research, that adjustments should happen at least, on a maintenance care basis, at least once every couple weeks to stop that degenerative process. Not only that, to activate the brain so your brain doesn't start to shrink. Does that make sense? And I mean, we're under stress all the time. In fact, I think it's more stressful nowadays than ever at any other time in history of this planet. In fact, I believe it was Yonkers University in New York, or Yonkers Institute. They did a study on stress, and they said 80 to 85% of all diseases related to stress. Okay, pretty amazing. when you start looking at some of these statistics. They spend $200 to $300 billion a year on stress-related disorders in the United States. The industry does. In Canada, we spend $12 billion, okay, on stress. Okay, so it is a big issue, right? It impacts almost everybody, all right? And so basically we know that these are some of the effects of it. And see, my neck continued to degenerate even though I was getting once a month treatments. Now, what I do now is different because after learning some of this stuff, and you got to realize things change, and I'm actually going to courses. I think I've told you guys, I'm taking some new courses, modules in functional neurology from Dr. Carrick, the guy who fixed Sidney Crosby's brain, basically. And so I'll be able to work with some of these brain-based disorders, which I'm really excited about, although it's going to take me 2.5 years. So, Mitch, don't ask me to check your brain to see if there's anything wrong, because at this point in time, I can't, okay? Although I can actually tell with some of the tests I'm doing already, because of what I learned to this point, hemisphericity. Hemisphericity is when one side of your brain isn't functioning as well as the other. And ideally, both sides should function fairly equally. But to be honest with you, you're better to have a healthier right side of your brain than you are your left, okay? And I won't get into the mechanism or the reasons for that, okay? But ideally, if you wanted to have one side functioning better than the other, the right side is the best one, okay? And so basically, what do I do now to maintain that? Well, guess what? I get regular adjustments. I go once a week, right? And you know what? I don't have pain. Now, why would I go once a week? Because you know what? I want to continue to maintain.
Keep the pain away.
Well, and not just, yeah. I mean, eventually it would cause pain, right? But that's not my motivation. My motivation now is this,
It's brain
okay?
health.
Brain health, right? I don't want my, cortex deteriorating to the point where eventually I turn to the woman that I've been married to for 30 some odd years and say, who are you? Right? I don't want that happening, right? And not only that, I want to be around for my grandkids. I don't have any yet, okay? But I want to be around to see if I can have some. Well, I'm not going to have them. My kids will have them. But I mean, I can, I can spoil them and then give them back to their parents.
Yeah.
Let them go crazy. So, I mean, I want to be around to do some of those things, right? And I know if I don't look after my spine, I know that's not going to happen. Right? So that's why I do that. I get regular exercise. I exercise several times a week. I try to eat better. I try to, do the things that I tell you guys to do. Your mental thoughts will dramatically affect your health. Okay? Your prefrontal cortex is actually a very important part of your brain, and a lot of its activation comes from the nerves in the spine. But when your spine is healthy, your prefrontal cortex is healthier. And basically, this is the area that modulates your behavior. Your behavior comes from what we call the association cortex, parietal temporal occipital lobe. And what happens is this area fires back into that area. Okay, so your PTO is your reality, right? Parietal temporal occipital lobe. So that's where you form your reality about things. So let's say, I'm just going to use this as an example. Let's say you're driving down the Deerfoot Trail. Someone cuts you off, and you get hot and mad. Well, that behavior, or that disorder, or that anger, or whatever you want to call it, is coming from this area, okay? And so, that area says, I'm going to punch his headlights out, right? I'm going to get him back, right? But then what your brain, your prefrontal cortex does, it modulates that behavior. It says, no, we're not going to do that, okay? And this is the area that gives you your social skills and basically allows us to live in societies. And so what happens when these things go, and our front part goes, we start to see what we call temporal escape. We see these explosive sometimes types of behaviors. We see all these different types of brain patterns that are starting to happen, okay? And again, what keeps that prefrontal cortex healthy? A healthy spine, okay? Now, I'm not saying there aren't other things you need to do, because there are, okay? By doing new types of things, learning new things, learning languages and stuff like that, doing new things. I'm going back to school, studying again. I haven't done that for 30 years, right? That's a good thing. That's going to help develop my brain more too. But by doing some of these things, that helps as well. You guys know about that stuff, doing different things, okay? But it's all critical, it's all important. But I got a question for you. After explaining all this to you, think about this. Okay? As far as exercise goes, if you start to, exercise is a lifestyle choice, right? Say you're going to start to, because you want to be healthier, say you're going to start to exercise, okay? How long should you continue to exercise for?
Till you die.
Always.
Yeah, till you die. Let's say you decide you're going to change your diet, you're going to clean it up a little bit, eat a little bit healthier. How long should you do that for?
Same.
Yeah, same, you know, till you die. How long should you keep, how long should you look after your nervous system? Your spine? How long should you do that? Yeah, for life, till you die. Does that make sense to you? Right, if you want to maintain a healthy lifestyle, and it is a lifestyle choice, coming to the chiropractor is a lifestyle choice, right? Then you got to decide you want to do it. Now, one of the issues I think with chiropractic, because we're not covered by Alberta healthcare, is finances for people, okay? And you know what? I don't like this system, because I know for a fact if Alberta healthcare covered chiropractic all the way, all of us, you know, and full amount and paid everything, I'd have to shut my door. I couldn't keep people out. I'd have to bar it, right? I mean, I'd have a lineup 5 blocks long, people trying to get in here. What tends to keep people out of a chiropractor's office is usually a financial thing, because you got to pay for it. You know, and the sad part is you pay for your medical care too. You just don't realize it, because about 40% or 40 cents on the dollar that you send down to Ottawa is paying for your healthcare system. You just don't realize it because you don't have to pay for it up front, right? But you're paying for it, okay, in taxes. Okay, think about what you could do with that other 40 cents out of the dollar. How many holidays could you go on? Okay, but the bottom line is it's a financial thing. But I'm going to tell you something right now. In fact, I'm going to give you this handout. Okay, this is an interesting study that was done with chiropractic care in the elderly. So they actually compared geriatric patients, those are seniors, under chiropractic care to a control group that never received chiropractic care. What they found was that the chiropractic patients were 41% less likely to be hospitalized, 79% less likely to use a nursing home. Do you think that's significant? Do you think that's significant? 79%.
79%.
Yeah. Think about that. 80% of the people in there wouldn't be there if they knew what I'm teaching you about right now. Okay? Now, talking about expense in chiropractic care. Do you know how much, you know this, Mitch, I think you do. How much does it cost to keep a person in a senior's home per month? Do you have any idea?
Oh, I think Grandma was paying, it was unbelievable.
Yeah.
I think it was a couple $1,000s a
Yeah.
month.
And you know what? If she was only paying $2,000, the government was still paying part of it on top of that.
I don't know if she had any,
Well, it doesn't matter. What happens is see, they do it based on your financial needs, for one, and the
well, I
level
think
of
Grandma
care you
was
need.
fine when it comes to finance.
Yeah.
I know it was a crazy, when Mom
Yeah.
told me, it was a crazy number, I just
Yeah.
could not believe it.
But what happens, you see, the government, for publicly funded nursing homes, because there are publicly funded, they pay for part of your care for being there. So what'll happen is the government pays a portion, and usually they pay anywhere from $1,000 to $2,000. You pay at least $2,000. So the cost of putting a person in a senior's home for 1 month is anywhere from about $3,500 to $9,000 a month, depending on the level of care you need, right? Now, if I can keep you out of a nursing home for 1 month, in fact, if I can keep you out of a nursing home for 1 year, that'll pay for your chiropractic care for all of this lifetime and the next lifetime, right? If you think about cost. The problem is we're used to the temporal, we're used to now. We don't think about the future, okay? But I can chiropractic care, it doesn't cost, it saves money. In fact, there's another study, and this was done in the States. Do you guys know what HMOs and PPOs are? Preferred provider organizations, health maintenance organizations in the States. Before, you know, they're messing around now with their health care. I don't know what's going to happen on that. But what happened, most people had insurance through their work. When you go to work, they have benefits plans. Company pays part of it and you pay part of it, right? That's how they do that. When you go to the doctor, what happens is the insurance rates go up. The more you will go to the doctor, the more sick you are, the more the insurance rates go up for the company. So these HMOs go into these companies and they say, we're going to lower your healthcare costs, your insurance costs, but you have to see our doctors. That's how they regulate costs. Okay, they control it. So their doctors don't get paid as much, but they have a guaranteed patient base, right? So that's how they do that, right? And so what they did in this one HMO in Illinois, they decided to use chiropractors as primary care physicians along with medical doctors. They found that after 2 years, the results were phenomenal. They found that using chiropractic services actually reduced hospitalizations by 80%, outpatient surgeries by 85%, pharmaceutical prescriptions by 56%. What do you think of that? Right? I mean, we do have solutions for our healthcare system's problems. We're just not using them. Does that make sense to you guys? I'll tell you something. You know, I just think the whole system is crazy. It's based on keeping you sick, right? And selling you drugs. Because guess what? They don't make money if you aren't on, pharmaceutical industry, they don't make money if you're on drugs. Do you know, in 2001, and that's 10 years ago, the pharmaceutical industry spent $45 billion that year. The top 9 pharmaceutical companies, I should say, spent $45 billion on advertising and only $19 billion on research. Now, is that disturbing? Do you find that disturbing? You know what, I do. Don't you think those numbers should be flipped? Yeah. Shouldn't it be 45 on research and 19 on advertising? It's money now.
Research doesn't make you money.
Right.
Marketing does.
Right. You got it. It's scary out there, what's going on and what's happening. I'm just about done. I just want to go over one x-ray with you. So how long should you look after the health of your spine?
Forever.
Yeah, there you go. As long as you got a spine, as long as you're walking.
As long as you have a spine.
What's that?
As long as you have a spine.
Yeah, there you go.
Until you get married.
Yeah. Do not say that when your wife's around. I want to show you this x-ray, okay? This is, after this, we're done. Okay, so this is an x-ray of a fellow that came in to see us. Originally, he came in approximately, I'm going to say approximately 20 years ago. He came in to see me. He had, I think, neck pain and back problems. And you know what? We worked on him back then, got him out of pain, and then he went on his way, and he didn't continue on with care, which is his choice, right? And so I didn't see him again for, well, at least maybe 15 or more years, right? So he came in a few years ago, okay? And this is the new x-ray that we just took a few years ago. But this time when he came in, he was very, very sick, okay? At this point in time, he was extremely overweight. He was obese, basically. He developed full-blown diabetes. His diabetes was so bad, he developed something called Charcot's joint. I got to explain what that is. Diabetics, they get what we call peripheral neuropathy. The nerves start to become damaged in the feet and the distal extremities, like the hands, okay? And so when those nerves become damaged, what happens is you start losing circulation and control of circulation. And so that's what was happening. And the bones in his feet literally got so brittle that gentle forces would sometimes cause those bones to fracture. He actually went to an exercise class, and just the weight of his feet on the bottom of the pool in that water caused some of his metatarsal bones in his feet to break. Right? That's how brittle they were. Well, they made these black boots, okay, for him that came up just below his knee, and they didn't allow his ankle to bend, but they were shaped in such a way to take the pressure off the bottom of the feet. And so when he came in, okay, he walked like this, okay, like a stick man, okay? That's how he walked. He couldn't bend his ankles, right? Well, he comes in, he's on all sorts of drugs. He's on Lipitor, he's on, insulin, metformin, these different medications that he's on, right? But he comes back, he's got all sorts of other issues now. Now he's got knee problems, he's got back problems, he's got upper back, neck problems, headaches, you name it. He had it. That's what he came to me for. So we started working with him. We were able to help him. He was doing great, symptom-wise, pain-wise, and we've been working on him for maybe approximately, I'm going to say about 10 months, right? He was doing a wellness care program. And so what happened is basically, he was doing much better. And what was really cool is his blood sugars were just starting to drop, okay? So he was just starting to change his insulin levels a little bit, which told me we were waking up some of these nerves going to the pancreas, right? And so what happened, this was a couple of months before Christmas, he was getting into his car with his wife, and just as he was getting in the car, he proceeded to have a full-blown, full-out, massive heart attack, and literally, he died right there in his wife's arms. Right? Now, why do I tell you that story? Okay, I'll tell you why I tell you that story. Because had I known what I know now, 20 years ago, when he first came in, and taken the time to teach him what I know now 20 years ago, had he made the appropriate lifestyle choices and changes that he needed to make, do you know what? He'd still be alive today. Because you know how old he was when he passed? He was only 50 years old. He's one of the, according to Boyd Eaton, he's a medical epidemiologist researcher, he's one of the 75% of the North American population that are dying prematurely due to lifestyle choices, right? And just getting back to that word, lifestyle choices, right? That's what determines, you know, your health status, your longevity. We know from research studies now, you know, they do these longevity studies, and now there's an abundance of information that's starting to point towards, you know, it's not a genetic thing. I mean, if your parents live a long time, doesn't necessarily mean you're going to. It's actually called epigenetics, okay? It's the expression of your genes that really matters, and they get expressed based on your environment, okay? So, is it important to look after your nervous system, the health of your spine and nervous system? Well, I think it is, okay? I'm basically done. Do you guys have any questions about anything? Does it all make sense? Yes? Yes? We're good? Okay, I'm going to end the video so that we can go out and look at your x-rays, okay? And your exam findings.